Hello and welcome to the next episode of the Psychedelic Medicine Podcast. I'm Dr. Lynn Marie Morsky, your guide on this journey. And today we're going to be discussing a little bit different thing on the episode. We're going to be discussing why we should not be pill shaming within the world of psychedelics. And we're going to have this discussion with Dr. Erica Zelfand. Dr. Zelfand is a recovering primary care physician who now specializes in integrative mental health and the interface between psychedelic healing and conventional medicine. In addition to seeing patients in her private practice and consulting worldwide, she is also an educator in America's first to be licensed psilocybin facilitator training program, a practicum site supervisor, and a retreat lead through Rise Up Journeys and Right to Heal. Now, before we get to Dr. Zelfand, just a reminder that the Psychedelic Medicine Podcast is for educational and informational purposes only. Nothing here is to be construed as medical or legal advice. And a reminder, as always, if you are a clinician or if you would like to tell your own personal clinician about psychedelics and you'd like them to know more about psychedelics, or you yourself would like to become more informed, please check out the Psychedelic Medicine Association. We have a number of experts that get with us every month for webinars. We present different research bulletins full of the latest findings in psychedelic science, all so that clinicians can feel comfortable having discussions with their patients about psychedelics. If you'd like to learn more, check out the Psychedelic Medicine Association at psychedelicmedicineassociation.org. Now, without further ado, thanks so much for joining us today, Erica.
Thank you for having me. This is a topic I'm really excited about.
Me too. And I was very excited. I have to tell the listeners the reason that what led to this discussion is that Dr. Zelfand had been in an article that Jules Evans, another former guest, had put out. And the article was called Psychedelic Pill Shaming, and we will link to it in the show notes. But Erica had a large contribution to that, and I really resonated with her thoughts on that. And if you don't happen to be too entrenched in the psychedelic world, then you may not know how much pill shaming seems to go on here. And so if we could start by you telling us a little bit, Erica, about what inspired you and Jules to put that article together, and maybe a little bit more also about what the pill shaming can look like around psychedelics.
Sure. Well, I've never been subtle or quiet about my criticism of pill shaming in the psychedelic industry. And I can't take much credit for the article. That was Jules's mastermind and his creation, but I definitely did flap my gums when he interviewed me. I had a lot to say about it. And when I went into medicine, I actually specifically went into integrative medicine, functional medicine, because I didn't like that patients were being put in this position of having to choose the conventional route or the alternative medicine route. Both routes have their merits and both routes have their shortcomings. And I felt like we all deserve to be able to access both and have it be an integrated model. And then when I started expanding both personally and professionally to understand that psychedelics are actually very powerful healing tools, I started weaving psychedelic work into my understanding of health and healing. And what I encountered in the psychedelic field was even more aggressive, we're the best, the other thing is stupid. If you use the other thing, you're doing something wrong. Even more aggressive than I did in any other field of medicine that I'd wandered into before, both from credentialed and non-credentialed providers in the space. I've also seen firsthand what happens when we pill shame people into stopping medication and quote unquote healing with psychedelics instead. Yikes, oh my gosh. So if nothing else, I hope this podcast can serve as a bit of public service announcement on that topic. And I really want to give you credit, Lynn Marie, for having me, because a lot of people don't want to hear what I have to say about this topic, because it tips the sacred cow of psychedelics heal everything and are the best in every way. which,
Well,
spoiler alert, they're not.
they're not. I like that. Spoiler alert. Well, I extra appreciated seeing your contribution to the article because you are trained as a naturopathic physician. And so I think maybe the common thought would be if anybody would be more on natural only side, it would be a naturopathic doctor. So to come from you to stand up for the place that both natural and by the way, natural is such a flimsy phrase of anything, right? Like, that's why this is no longer called the plant medicine podcast, why it is called the psychedelic medicine podcast, because some of these are natural, some of these are synthetic, some of the synthetics are made from natural things, right? It's just such a cluster to try to give that type of title. But I appreciated that you stood up for the role that traditional pharmaceuticals will say play in healing alongside all the integrative functional and psychedelic modalities, east west, all the things out there. So it gave me an extra, like, warmed my heart to see that coming. I'd expect it coming from my like family medicine colleagues, but like I loved that somebody with your background was standing up for it more than I'd seen basically anybody else in the industry do it. And like you said, some of us may be thinking it, but I always appreciate somebody who says out loud and stands up for it. And I think this has come up, this either or situation has come up one other place in the podcast history. But we did an episode on non-hallucinogenics. And that's another, like, one of those, do all psychedelics have to have a trip to be effective? Like, so when I think about the kind of these false dichotomies that people put up, when the actual answer is, like you hear in improv, yes, and like, this shouldn't be an either or. This should be yes, all the modalities. So if we could get into, let's talk a little bit just for those who might not realize how prevalent it is or what kind of things pop up. Can you talk about some of the pill shaming type of rhetoric, subtle and less subtle, that you've been witness to?
Oh my gosh. Well, I think it's rampant. For example, I recently had a guest come on one of my retreats. And by the way, I serve medicine to people who are on pharmaceuticals. So, like, I'm just going to say that right from the get-go. And yes, they heal and it goes great. There are some special considerations. So I'm not giving everyone carte blanche to go do this. There are risks, certain things you need to have on the radar, but I don't think I've ever held a single retreat where there wasn't at least one guest on a pharmaceutical. And we recently had a guest come who, she said, you're kind of a smaller company. I haven't heard that much about you. We're relatively newer in the space. But, there were so many reasons that I chose you. And one of them was, some of the other operators won't even take you if you're on a pharmaceutical at all. And this guest actually encountered a different retreat operator's website, which on their homepage says, "Stop medicating, start healing."
Ooh.
And that to me is such a sucker punch to an entire branch of medicine that does help people heal, actually. Can absolutely be used to blunt response or numb or bypass, or can be used really strategically to improve somebody's window of tolerance so that they can go deeper in their work and so they actually can do some healing. And just those subtle, I don't think it's that subtle, but other people might say, like, those subtle messages in the space of, as we're presenting psychedelic healing as this very profound modality that works indeed through completely different and novel mechanisms, there often becomes this poo-pooing of the established model in order to elevate this model. And when we do that, we actually shame a lot of people who maybe need both models, and kind of bully them into saying, our way of healing is the right way. And if you don't do it this way, well, you're using a crutch. Well, I guess you're not really ready to heal. Just kind of these I don't know, peer pressure-y, weird bullying attitudes in the space. And part of why I feel so impassioned around this is because I've seen what happens when people go off their meds too fast or for the wrong reasons, or maybe it just wasn't a good fit for them to go off their meds and then they try and heal with psychedelics. And I mean, this is my public service announcement. Please don't do that because I clean up those messes in my practice every week and it
Wow.
ain't worth it.
Yeah. And I think, and we'll say, and you alluded to this, but there are some psychedelics that you can stay on certain medications while you're doing them. And by the way, we're saying pharmaceuticals. I think people are probably thinking we're talking just about antidepressants. There's lots of pharmaceuticals people can be showing up with, your antihistamine because you have allergies, right? Like, I don't think anybody's being shamed. Okay, maybe I've lived in Austin, so maybe not nobody's being shamed, but definitely had somebody trying to shame me for taking an antihistamine at some point. But I think that most of us, there's so much less stigma around, oh, I have allergies. I got to take this Zyrtec so I stop sneezing in your face all day, compared to I need to take an SSRI for my depression or an anti-anxiety medicine. And so people might show up on a pharmaceutical that's not a mentally addressing pharmaceutical, right? Like, what if it's for their cholesterol because they can't get their cholesterol down, or they have diabetes and if you have something like type 1 diabetes, you need to be on a pharmaceutical or there's very little chance you will still be with us, right? There's like, you're not producing insulin, you better be on a pharmaceutical insulin, right? So to shame an entire class of, like you said, an entire wing of established medicine that has saved a bajillions of lives, right, is senseless. But then you also, even as you were talking, I just felt like this deep ache for like anybody who sees that you're clearly not committed enough if you can't just stop your meds. And so if you could talk a little bit about, and I know we don't want to get into too many specifics because again, this is not medical advice, but there are some um medicines that they do suggest you wean off antidepressants for. Can you talk a little bit about if that is the case, if somebody is going into a medicine where they need to be weaning off their medication, what's the safest way to go about that?
Yeah. So I appreciate you bringing that up because one of my mottos is use all the tools. And some of the tools you can't use concurrently if you want to continue walking on this earth. So an example of that is ayahuasca. Ayahuasca contains a brew of at least two different plants. One of them contains DMT, the other one contains a monoamine oxidase inhibitor, which is a pharmaceutical compound essentially, but just a natural one. So monoamine oxidase inhibitors, pharmacologically speaking, they combine well with just about nothing. So any psychiatric medication combined with that monoamine oxidase inhibitor, like we see in ayahuasca or like we see in Syrian rue, that can be a very serious and sometimes even life-threatening drug-drug combination. And I'm in no way endorsing that. So here's what I see sometimes is a client will come to me and they'll say, I really want to do this ayahuasca ceremony that's in 2 months. I've been on this medication, insert serotonin affecting drug, fluoxetine, duloxetine, whatever, I've been on this drug for 5 years. Can you help me get off this drug so that I can do the ayahuasca ceremony in 2 months? And the answer is absolutely heck no. No. Drug tapering takes months and not weeks. So with a drug taper, I really discourage having a deadline because you just don't know how your unique chemistry is going to respond to reducing this drug. And your body sets the speed, not your calendar. And so what I see happen, now this doesn't happen on my watch, but I clean it up on the back end, is people taper their meds too rapidly, which is a chemically destabilizing thing to do, which in turn becomes a psychologically and emotionally destabilizing thing to do. Even if the drug taper goes well, if it goes too fast, about 6 to 8 weeks after the person stops the drug, they often decompensate and have their crash, whether or not they use a psychedelic. But in that window, they'll then go and take a psychedelic drug. And taking a psychedelic drug is a destabilizing event. even if it's a good thing, even if it's just disrupting business as usual or destabilizing a pattern of thought that keeps you small and thinking you're unlovable. Nonetheless, it's destabilizing. And so you've got a chemical and emotional destabilization as your shaky foundation for a psychedelic destabilization. And then we've got a crash and burn on the back end. And I actually saw, like, wow, what perfect timing. My last patient right before we hopped on this call was someone who was such a case, or is someone who was such a case. It took them almost a year to restabilize her
Oof.
psychiatrically after she discontinued medication too quickly to do a psilocybin retreat because she went to a place that wouldn't let you come if you were on psychiatric meds. So don't do that. I mean, it's great job security for me, but my gosh, are these
Right.
are these
That's,
stories harrowing? Um,
yeah.
or this like, oh, I'll just skip the med this week in order to have this journey, and then I'll go back on the meds. Yikes. Sometimes it goes well, but a lot of times it really doesn't. Um, and these medications are designed to be taken on a regular basis for them to stabilize our neurochemistry properly.
Yeah. And let's talk about some of the reasons that somebody's struggling may, look, they are struggling now. They know that they have, maybe they'd have to leave the country or go to Oregon or in some way have to alter their plans to do the psychedelic. And they also have in front of them a pharmaceutical option. Can you talk about some of the reasons that they may want to at least start with that pharmaceutical option?
Yeah, well, there's no guarantee with either option. First and foremost, I hate that I have to say this, but it's true. When it comes to psychiatry, any any intervention is you try it and you see if it works. It is a guess and check process. And this includes, okay, we want to start you on an antidepressant. Which one? Okay, let's try this one. Let's give it 2 to 3 weeks. We used to say 4 to 6 weeks. Now it seems like, okay, within 2 to 3, we know. 2 to 3 weeks is a long time to wait if you can barely get out of bed or if you're thinking about ending your life daily or you're extremely anxious. That's a long time. And then, oh, that one didn't work. Now we're going to try this one and give this 2 to 3. So I just want to say folks in that position have all my compassion and all my support. Um, and sometimes it just does boil down to a gut feeling on, I think this is what's going to help me, or I think this isn't. I'm also just going to make a plug for ketamine because it works a heck of a lot faster than a lot of the conventional pharmaceuticals that we have for psychiatric well-being. We're talking about hours or days, if not weeks. So hooray for that one. So yeah, and if someone does consult me and say, I'm thinking about starting an SSRI or to go do a psychedelic experience, obviously that's unique, and we talk it out and we find that what's feeling right for you. But if it's all like apples to apples, then I would say try the psychedelic experience because that's not something you have to take daily and see what that gets you. You can always, do this process of titrating up, waiting the 2 to 3 weeks, seeing what the benefits are, reassessing in a month. That's a more lengthy process. And it absolutely does not make sense to start a psychiatric medication like an antidepressant if you don't intend to stay on it for at least 6 months, assuming it's working for you. So this like, oh, can I just take the paroxetine for like a month or two? And then it's like, no, I mean, you can, but why? No, it's not a good idea of like making that commitment. So, yeah, it's really unique person to person what the right call is in that position.
And I would say you bring up something that, like, as I was thinking, the person who like is apples to apples, I'm guessing they seem like either somebody who's apples to apples is such a severe case and they already are so severe that they've got their psychedelic, like, maybe a nonprofit or somebody else has helped them and they're like ready with their ketamine journey, or they were going to start an antidepressant. But I'm also like, that seems like one scenario. Another scenario seems like somebody who has more of a like moderate depression, who wasn't, perhaps the first person was like acutely suicidal. And then there's the people who are like in the moderate depression. And I think that was kind of my question, is if maybe not apples to apples, where the person can't get, maybe because let's be very honest, ketamine is very expensive. And if somebody's in a position where their insurance will cover them to try these things before they're able to, and they maybe won't cover ketamine at all, and they're moderately depressed. Okay, there's one scenario. And then there's, like you said, the other scenario where if the person is acutely suicidal, let's not make them try 2 or 3 different antidepressants to see if one gets them to a point where they're no longer acutely suicidal. Let's go straight to ketamine. But I'm guessing there's a role for that person who may have started off so down, so deeply in the recesses of depression that they're suicidal, that there may be a role for both, like ketamine kind of getting them out of the acute suicidality, but it may not get them out of depression completely. So maybe it gets them, boosted enough that they are open to then starting on a course of antidepressants. Have you seen that kind of scenario?
Absolutely. Absolutely. And I'll also say, for better or worse, and I can definitely critique this, but just will mention that the only form of ketamine that is FDA approved for depression, which is Spravato, is only approved in the context in which the person is also taking an oral antidepressant.
Oh, that's a great thing to be reminded of. I had forgotten about that.
Yeah.
Yes.
And then repeat your question because
Oh,
I
I was
was.
just saying, like, is there a scenario where somebody uses the ketamine to get out of acute suicidality, but then would still so it's again, it's not an either or, it's more of a stacking timing issue. Like they use one to get out of the acute suicidality, and then they use the other to continue to work on their depression.
To run their maintenance program.
Yes.
Absolutely. Absolutely. And I have seen that in more than one client now, where working specifically with psilocybin really took the edge, and ketamine. How do I want to put this? I feel like ketamine chemically took people out of that danger zone. I've also seen psilocybin in a more philosophical way pull people out of that suicidality zone, but it still doesn't quite crack the depression. And this is where one drug can pick up where another one leaves off. And this is where we can't always predict what that course is going to look like because, surprise, surprise, each person is unique and each person's healing work is unique. I also, in my medical practice, I do also prescribe ketamine microdosing. I'll mention that as well. And sometimes we're doing that in addition to another pharmaceutical. Sometimes it's a standalone treatment. And then, some of those folks are doing a big dose ketamine journey, maybe once a quarter to maybe go deeper. But, ultimately with all of these, what I'm trying to say is it's really hard to go really deep into the subfloor of your subconscious and do sometimes pretty harrowing work of looking at your shadow and examining your wounds when you're already hurting so, so, so much. And having it's like driving down a really, really bumpy road in a car that has no shocks. And to let yourself just get some shocks for the ride, um, you're still going to get a lot out of the ride. You might even get more out of the ride.
Because you're not so
And
traumatized.
yeah, because maybe you're able to actually dig in your heels and face the monsters.
Yeah. Instead of just hanging on
With
for dear life.
yeah, yeah, exactly.
Yeah. And I
Doesn't
would go
always have
ahead.
to hurt.
Right. I love bringing, okay, great point to reiterate that. I think it was brought up, man, first on my podcast back in 2020 that somebody brought this up, but like the no pain, no gain, it should be thrown out the window when it comes to
Very true.
psychedelic healing. It is not like how terrifying was your experience that equates to how healing it's going to be. That can actually have the opposite effect.
Mhm. Yeah, and we actually now have data, like thank goodness we can now, the wonderful researchers who are able to above board research psychedelics, we have data showing that if you feel like really, really freaked out and anxious during your trip, um, your outcomes aren't necessarily as good. And the biggest predictor of having a positive experience is actually feeling awe. You don't have to do the ego death thing, but if you can feel awe, if you can feel inspiration during a trip, your outcomes are better. And there's even data showing that individuals who are on an SSRI and then trip, they may actually have better outcomes than people who don't take medication because they're able to stay kind of out of that dysphoria zone. Now, I want to make it very clear, sometimes the healing is in the dysphoria. Sometimes the healing is in the pain. It's going down into the basement where the cockroaches and scary monsters are. And sometimes that absolutely is the work. Absolutely. Sometimes people take psychedelic and come out feeling more rattled and traumatized than when they went in. And that's, and that's where perhaps a pharmaceutical medication can be an ally and not a hindrance to that healing process.
Yeah, the last episode that came out was with Keith Kurlander from IPI, Integrative Psychiatry Institute, and the discussion was integrating challenging psychedelic experiences. And we were talking about from the slightly difficult experience all the way to like psychosis. If you're at psychosis, you're going to need a pharmaceutical, right? You're going to need something to restabilize you. And like, shouldn't we be grateful that these psychedelics, which are not precision targeted at this point, so when we go into them, we are all taking a risk of certain adverse outcomes. Shouldn't we be grateful that if we ever happen to need it, there is a pharmaceutical out there that may help us in that time of distress?
Yeah, we've got that life buoy.
Yeah, absolutely.
Yeah.
And I'm thinking, again, like I want anybody out there who is because this pill shaming isn't just obviously within psychedelics. This is a thing that has been going on mental health was stigmatized forever, right? So thanks to the pandemic, there's less of a stigma and we're getting there, I think, with medicines. But what you had said something like is that I want to reiterate. You talked about like there should be no shame in needing the shocks. And
Mhm.
is there more that you could say that might help people that are still feeling shame about like, oh, like I think the misconception is why can't I do this on my own with these other tools? Like somehow the medicines are a cheat. It's the same thing with like shaming people on Manjaro who like absolutely could not lose weight otherwise. Now we're going to shame you for taking a medicine. But like in this
Right.
specific case, what could you say to those people who are still struggling with that maybe self stigma or society stigma?
Your only job is to heal. And if you build a house and you only use a hammer and nails versus if you build a house and you use a nail gun, does it really matter? Ultimately you have to live in that house. So, there's one thing about taking so much medication that you've just completely snowed yourself so you don't have to feel anything, which by the way has its place also. Um, and it's another thing to use all the tools that are available to you so that you can stay on board and like your life, you know, and hopefully doing things in a way that encourages your curiosity and your personal growth process and your healing process as opposed to hinders it. And some of the most aggressive pill shaming that I see is actually from the cannabis space. And a lot of the people who are spewing said things are people who use cannabis not just daily, but multiple times a day, who talk about like, oh, well, you're using something that's altering your brain chemistry, that's numbing you out. It's like, well, that's a little bit of the pot calling the kettle black, is it not? Um, and just being mindful of how we're using these substances. And so sometimes I do help patients, sometimes patients come and they say to me, this drug, insert pharmaceutical name, this drug hands down saved my life. This drug saved my marriage. This drug allowed me to parent my children in such a way that I did not abandon or traumatize them. And I am so grateful to this drug. And now I can kind of feel that it's not letting me have the full range of human emotion and experience that I want. Okay, let's talk about lowering the dose or maybe discontinuing it entirely. But if we do that, then what's our plan for as you start experiencing that wider range of human emotion, which by the way is going to entail irritation with your husband, anger, resentment about old wounds. What are we going to do to help you when those things come up? Maybe therapy, maybe a kickboxing class, maybe psychedelic healing journey, maybe microdosing. Of that pressing back into a richer life. And we started touching on this earlier, but the thing about the no pain, no gain approach, which by the way also gets masked as you have to feel it to heal it. Sometimes it's not true. It's a very masculine warrior approach of like healing is kind of a punishment, or like you have to go through hell before you get to feel better. And when you're already in hell, that's the last thing that you want to hear. It's the last thing you're willing to do. It's the last thing you're able to do. You don't always have to go through hell to feel better. Sometimes you do, and we don't need to bypass that when it happens, but sometimes you just get to heal. And sometimes it can even be lovely and beautiful to do that. And that can be with or without a pharmaceutical. It can be with or without a psychedelic. It can be with both. And
Yes.
it's unique to each person what that's going to look like.
Yeah, absolutely. Thank you for putting all those points on that. I think some of those are so important for people to understand and internalize if they have been punishing themselves. It's funny, there's this thought if you're going to win something big, then you should have worked to win the big thing. But when the big thing is just the normal level of contentment with your life that people without mental health have, I don't understand why it should be some kind of you have to go through hell just to be at the place that other people are at without they didn't have to go through hell. They just had different life experiences, or maybe their brain chemistry is a little different. Whatever it is that has led you to be in this, why would you have to go through hell just to get to baseline where other people are at baseline? That makes no sense. And like you said, you just deserve as a human being to feel that baseline of contentment that you would if depression hadn't snuck in, or PTSD or anxiety or the other things. Have you seen, and I'm assuming the answer is yes, but if you could discuss some situations where, and I love that you brought up the fact that somebody who has used antidepressants, like you said, they're tools that can be for a period of time. And like you said, as long as that period of time is, 6 months or so, but like great, they were able to help themselves through maybe a life transition for a while or raising the kids or whatever. And now they might have a wider range of emotions and they're going to potentially use psychedelics to address those, or maybe even delve into things that they weren't quite able to delve into before. On the flip side, do you see patients that have been on psychiatric medications and then they do a psychedelic journey and that helps them start to taper off?
Oh my gosh, yes, hugely, all the time, all the time. Because, also one of my mottos, well, it's not mine. It's what I was taught as a naturopathic physician. It's one of the principles of naturopathic medicine is to treat the cause. And sometimes, and I always ask people, like, if they come in with depression, anxiety, I'm like, what do you think the actual cause is? And oh, it's, just working this job, it's being a single mom, whatever it is. But sometimes what we can get to through the psychedelic journey is that root of the blackberry bush where they're like, oh, the cause of the depression was actually that my mom remarried when I was young. I was raised by my stepdad. They had 3 other kids. I never really felt like I fit in the family. And the root of my depression is that I feel like I have to actually apologize for taking up space. And now I understand this. And now I'm giving myself permission to just take up space. right? And so when we identify and treat the actual cause of the depression, then getting off of the antidepressant, it's not about taking away that person's emotional support anymore. It's just about tapering slow enough that their neurochemistry can handle the withdrawal. And we do see more successful taper in that process. But I've also seen the opposite happen where someone does a psychedelic journey and they say in the journey, they go, you know what? The medicine's telling me I really need to get back on my meds. Or like I
Interesting.
should really be upping my dose. And they get that insight.
I love
So
that. That's interesting.
I've also worked with more than one person now, but the one I'm thinking of just because I saw her today, she went off of her meds because she was told if you're on an SSRI and you take psilocybin, you're going to get serotonin syndrome. This is like what the doctors who like know just enough to be annoying are saying. So she went off of her SSRI and she did her psilocybin experience, and she actually accessed a repressed memory in the psilocybin space. And it was way too much, too fast, too hard for her. She was also dealing with acute drug withdrawal in this process. And it's only now, I think it's about 3 years later, she's back on her meds. She's feeling like she's got that solid chemical baseline where she's like, okay, I actually feel like I've got my legs under me now. And I'm ready now because I feel like I've got like my sword and my shield with my meds. I'm ready now to process that repressed memory. And we're preparing for her to do a psilocybin journey within the next few months. So we see it go all kinds of different ways in the
Yeah,
medicine.
yeah. And I love that, like you said, when those things happen, the tools are there, right? And I think this is what's so important. We've done a number of episodes on how to select a retreat facility or facilitator. And one of the things we pointed out that, in an ideal world, I'm going to get so much hate for this, but in an ideal world, there would be a medical professional with that kind of experience able to consult on every person going through a retreat, right? Because first off, I mean, it was absolutely obscene to me how many retreats were not asking what medications people were on. And there was, even if they did, do they have a medical person or a pharmacologist or a pharmacist looking over them to say whether or not that was going to be contraindicated or if they could stay on their meds or not? And it's it's just so important for the harm reduction aspect of things and the benefit promotion to have, like, with somebody like any of those situations you mentioned, somebody who's versed in both the psychedelic aspect and the pharmaceutical aspect to know when to use what tool and how to balance them both.
Yeah. And I mean, I would love to see that. I think part of why we don't see that, Lynn Marie, is one, liability. Nobody wants to be on the hook for that. But two, we actually don't have a lot of that data,
Right.
you know, and a lot of it is conjecture. And, just, kudos to folks like Ben Malcolm and Emily Culpa, our pharmacists who understand the drugs better than, most clinicians do. But it is ultimately conjecture using this very, very limited body of evidence that we have, extrapolating from that. The studies we have on SSRIs, most of them are on S-citalopram. Can S-citalopram tell us about every other SSRI? No, frankly, no. But are we in a position where we have to extrapolate that data and apply it to every other SSRI? Yeah, currently we are. And, we have these substances have been in use since at least 5,000 BCE. But, they didn't make Paxil 5,000 BCE.
Right.
And they didn't make statin drugs, and they didn't make Mounjaro 5,000 BCE. So it is a little bit of the blind leading the blind on this. And so I think part of this trepidation is we don't want to harm anybody through a dangerous or a potentially lethal drug-drug interaction. That's one thing. It's another thing to be like, yeah, but if you're using these drugs, you're doing it wrong and you're not
Yeah.
healing right. right? And I think the one often like is used as a camouflage for the other.
Yes.
And
Yeah.
they're two separate things.
Very well said. And here's where I'm going to make my other ploy, because of course, yes, I also run the Psychedelic Medicine Association, where we are trying to educate clinicians on these kinds of things. And like you said, some clinicians are at the point, definitely not our members, but some are at the point where they, like you said, know just enough to be dangerous-ish. I mean, if they felt comfortable enough with psilocybin to say you shouldn't take an antidepressant on psilocybin, that's more than your average doctor knows. Because again, and this is where I like to anybody out there who's out there doctor shaming, or for not knowing psychedelics, we can't know something that was never taught to us, and it's not FDA approved. So the vast majority of continuing medical education courses are not covering this, right? You have to go to somewhere like one of your courses or one of the Psychedelic Medicine Association's courses, or be a member of to learn this. And there's not a lot of incentive to learn something that you can't even prescribe to people at this point, right? Like, doctors are like, I've got to learn all these things. What can I learn about that's cutting edge, that I have to use in the clinic tomorrow, versus, okay, psilocybin is now available in like one state, right? And so people in Oregon, it'd be great if they got up to speed on that. But like, please stop shaming your doctors for not knowing things. I see a lot of that, because they don't want to do you harm. They It's just something that we were not taught about in medical school at all. And to your point, because there's so little that we know, how are we going to be taught? Well, here's the 3 studies that have studied this, right? Like there's so much that's still a big question mark. And so you're right. Like it's all a liability, but that is completely separate from the pill shaming side, right? Like it's one thing to be unsure if your medicine is going to work with psychedelics or not, but another thing to shame you for using it instead of psychedelics or in addition to psychedelics.
Totally. Yeah. And we do sometimes see the reverse, where a patient goes to their doctor and says, I'm thinking about doing psychedelics. And the doctor's like, well, we don't have any evidence and you might break your brain, and
Right.
kind of shaming that front, which is, equally nefarious. I also just want to mention, just because I think it's fun, that it was during, I want to share a trip that I had on a pretty big dose of mushrooms, where I got to talk with the spirit of Cymbalta, which is duloxetine.
Do tell.
And I got to talk with the spirit of opioid medication. And like, if I can just be the Lorax and speak for the drugs for a second,
Sure.
they're
I
really
mean,
they're really confused as to why everyone's angry at them. And the duloxetine was like, I don't get enough credit. Why does ayahuasca get to wear the tiara all the time? Do you know how many lives I've saved? Do you know how many people's like lives I help and I touch? And it was like a honoring of like, thank you. Like it just wanted to hear a thank you. And I was like, thank you for everything you've done for my patients and countless other people.
I love that. That is one of the more interesting stories anybody has told on the podcast, for so many reasons. But I mean, but you put a fine point on the fact that yes, those have they like the irony of shaming something that has saved so many people, right? And like you said, they might tell you that it saved them. Do they tell everybody else because of the stigma? The same person who's pill shaming, their partner might have been saved by this thing, or their family member or somebody, but they might not share that, and so then the pill shaming continues, and it's like, why are we shaming people for the ways that they need to be helped, as long as they're not hurting somebody else, right? And so I so much appreciated your contribution to that piece, and just overall the fact that I see you, I follow you on LinkedIn, and you very often speak up when there's a lot of doctor and pill shaming out there, and between me standing up for the doctors and you standing up for the for the pharmaceuticals, it's like we're trying to do what we can. So I just want to send my gratitude to you. Maybe someday you'll see me in a psychedelic journey. I'll be like, thank you, Erica. This
And then we can tank some pharmaceuticals together in that space.
That's hilarious. Yes. Can you tell people where they can find out more about you and your work?
Yeah, so my last name's a bit of a doozy. So if you can spell Zelfand, drzelfand.com. The other place is I'm also the executive director of a nonprofit for mental health called Right to Heal, RIGHTTOHEAL.com.
You like how she spelled that out and not Zelfand? She's like, you're on your own for
Yeah,
Zelfand, but she
well, because people miss, like, even if I spell it, they still get it wrong. So
Zelfand.
yeah, then they're like, is that a Z or a V? Is it an F or an S?
Oh,
It's a little
we got
gets
you. Well, show
tricky
notes.
in there, but yeah, we'll find each other some way,
Yes.
somehow.
drzelfand.com and righttoheal.com.
That's correct. Yes.
Excellent. We got it. I again appreciate you being on and sharing all the things that you shared. And I look forward to continuing conversations in the future.
Ditto. Thanks for having me.
Absolutely. All right. For everybody else out there, until next time.